Hi, folks. Welcome to the Getting Your Edge podcast. My name is Dennis.
And hi, I'm Judy Gratton.
And we're here to help you right-size your home and your life. Welcome back to Getting Your Edge, How to Right-Size Your Home and Life podcast. I'm Dennis Day with my guest co-host, Judy Gratton.
Hello, Dennis.
And we are here today with Kevin Anderson, a licensed Medicare advisor. And Judy, can you give Kevin his introduction?
I certainly can. Kevin is a good friend of mine, obviously, because we're sharing a screen down here in Long Beach, Washington. And what brought my interest in Kevin to a peak is around Medicare. And Kevin's been on before. But just to give you an idea, Kevin Anderson has been licensed in insurance in the states of Washington and Oregon since 1997. And his focus became Medicare in 2012. Today, he will be sharing about Medicare enrollment periods and the infamous donut hole, which I know a lot of people have questions about. And I will tell you another really interesting fact, and that is that he's also been inducted into the Who's Who's registry for his literacy accomplishments. So there. So can you tell us what you did? What did you write to get in the Who's Who of America?
I can do that briefly. I co-authored 5 textbooks, varying levels of Spanish that are used in universities. And that's what got me inducted into the Who's Who.
And maybe you could become my Spanish teacher someday.
Sure, you bet.
Right. Well, Kevin, can you tell me, Medicare is really confusing. Kevin and I had condos in the same place in Long Beach. And when I found out he did Medicare, I came to him when I had questions. And that's how we got started down this path of interviewing him on Medicare. But it really is confusing. And I have a friend that always seems to be falling each year into the donut hole. What does that mean exactly? And are there any changes related to it?
Excellent question, Judy. Thanks. The donut hole is something that most people that have any knowledge of Medicare, maybe it's a family member, that an aging parent that falls into the donut hole. Typically, it's in June or July. I've had clients fall into the donut hole as early as March. And sometimes it's not until November. So what does it mean when you fall into the donut hole? It sounds to a coffee-drinking Norwegian that would be a good thing, fall into the donut hole and eat my way out, right? The donut hole is when you have paid $5,000, a little over $5,030 towards your medicines. Then you enter the donut hole. And while you're in the donut hole, you have to pay 25% of your cost of your prescriptions until you've paid in $8,000. And then you come out of the donut hole and you enter catastrophic coverage, which sounds bad, but actually is a good thing. Now, Congress for many years has been trying to shrink the donut hole. It used to be you fell in $3,000. Now it's $5,000, and you should take longer to get out. You used to have to pay 100% of your medicine. Now you pay 25%. And now when you hit catastrophic, if you get to 8,000, now your plan, no matter who the plan is with, is going to pay 100% of your medicines. This is great news for those that have long lists of medications. We have clients that have over $20,000 a year that they're paying into for the cost of their drugs. Now it'll be this year, starting in 2024, only $8,000. As I say only, that's terrible, right? For folks that are on limited income, Social Security, retirement. But once they hit $8,000, no matter what plan they have, it's covered for the rest of the year.
So when you said the first $5,000, is that money that is also being subsidized by the insurance? And then the other 3,000, so it's a total of 8,000.
That's correct. It's a total of 8,000, and it's 20. You're 25 for that 3,000 gap. You're 25%, and they're 75%.
Okay.
Yeah.
And then when you're above that, then it's 100% paid by the insurance companies.
Correct.
When did that come into play?
That's this year. Last year, there were different criteria, different numbers to fall in the donut hole, different numbers to come out, and you paid a greater percentage.
Okay.
Now, since we're talking briefly here about drug plans, in the state of Washington, there are 20 separate drug plans. Some companies like United might have 4 or 5. Some companies only have 1, but there's 20 to select from if you're on a supplement. If you're on a supplement or Medigap policy, it doesn't come with drug. Now, we're also going to talk about Advantage plans that have a built-in prescription plan. But the standalone drug plans cost anywhere from $0 to $127 a month. Now, how can a drug plan cost $0? Well, the ones that cost $0 have a $545 deductible.
Oh, okay.
So that's equivalent to $45 a month throughout the year before it pays. So you might be better off getting a $25 plan and get coverage right away than to get the free one and have to spend the first $545. But $127, that's the span. You need to find a good agent to help you get all your medicines into the computer, and it'll tell us which is your best plan. So that's the donut hole.
Now, my mother is on a medical plan with Medicare, and it covers nearly everything or very minimal copay. But there is one drug in there that is excessively, it's $150 a month just for the one. What's going on there?
We're going to stay away from the political arena, but there's been some changes, and all across the board, because of supply chains, because of demand, medications have risen in cost. But now, what can she do? Now, I happen to know, Dennis, because you and I have spoken on the phone, that your mother is on an Advantage plan, and that the current Advantage plan that she's on has a built-in drug component. So she doesn't have to have a standalone drug plan. So what can she do about this one medicine that costs so much money? Key point to remember is that all Advantage plans come with a formulary. The formulary is specific to that company. It's approved by Medicare. So when they set up that plan, Medicare, the CMS, Centers of Medicare Services, approve it, and they'll say you have to have 3 steroids. Well, the company gets to pick which 3, and maybe it's not the one your mom needs. That's part of the formulary to get the best prices. So what we have to do is when someone wants to look at a different plan, or if their plan is the best right now for their county, you want to enter the drugs, because maybe Advantage plan where the doctor costs $5 and it isn't free will save her $150 a month because the formulary on the drug plan built into it is better. Does that make sense?
Yeah.
With Medicare, you enroll at certain periods of time, and then you've got that plan until the next enrollment period. And I don't really understand. I thought it was at the end of the year, but you and I had a big discussion because I'm with United, and the hospital and a lot of the medical companies that I work with are under Evergreen, and the two of them for a period of time did not have a contract. So but you were telling me the enrollment periods, there was more than what I thought.
Yes. Very good question, and that was a great example to illustrate some of the struggle we had. As you and I spoke in the fall, should Kevin, all my doctors are in this one network, and now they're negotiating and they're not signing up, and what do I do? Do I need to change plans? And I told Judy, you can wait until January or February, and I'll tell you why. But before I get to that, let's talk about enrollment periods. To sign up for Medicare, you must have an active enrollment period. Well, let's start with ICEP. The initial time that you come to Medicare, when you turn 65, you have your birthday month, and you have 3 months prior to your birthday month to sign up, birthday month, 3 months after your birthday month to sign up, and it's guarantee issue. There's no waiting periods, pre-existing condition exclusions, nothing. It's guarantee issue. You get your plan if you do it in that 7-month window. It's 6 months plus your birthday month. That's your initial enrollment period when you turn 65. Now, some people are still working at 65. This woman right here is still working, and she's 66 years old now. She's still working. Well, you don't have to be on Medicare. If your employer supplies you with good medical coverage, you can keep your Part A, opt out of Part B, and then you don't have to pay that Part B premium until after you leave your employer and retire. So some people do that, and that's called a delayed B. That's part of an SEP, alphabet soup, right? SEP is special enrollment period, and there's many of them. Special enrollment period could be because you moved to a new county. A special enrollment period might open for 63 days if the company you're with has left the county. There's all kinds of special enrollment periods that happen, and they're throughout the year. Now, annual enrollment period, which is what you were talking about a minute ago, every fall we start seeing these commercials on our TV, right? And I'm on Medicare as well, and I get those phone calls. October 15th through December 7th is when you make your decision for the following year on which plan you want. And in the state of Washington, no matter if it's a supplement or an advantage plan, those are the two worlds, it's guarantee issue. If you decide you want that plan by that company, they have to issue it to you. Even if you have cancer or kidney dialysis, they have to give that plan to you. That's annual enrollment period, AEP every fall. Now, the one that I was alluding to that she did not have to make her decision by December 7th is OEP. OEP is open enrollment period, and it starts in January 1st and goes through March 31st, and nobody knows it. And what it used to be that it was just a short 4-week session where if you didn't like the plan you chose, as long as you did it by the 1st of February, you could switch to a different plan without consequence. Well, now Medicare 3 years ago changed that January 1st to March 31st. As long as you have an advantage plan, which you do, and you have a very good one, but if you decide, like with this network that she has most of her physicians at, it's a large network in Kirkland, Washington. If she decided, well, they're not going to take my plan, well, then let's go to a different company. We'll find you a plan that they will take because they were negotiating and using hardball tactics. They finally did come around, and they're part of the network again. But open enrollment period only allows you to change from one advantage plan to another advantage plan. You cannot change from an advantage plan to a supplement or vice versa. Only advantage plans.
So, we were talking about before and the 3 months after you turn 65, you must apply for Medicare. Otherwise, your Medicare will be more expensive forever, correct?
If you don't, Medicare does one of these, slaps you in the hand, which is the hand that reaches into your pocketbook. So you're correct. If you don't have a drug plan with creditable coverage, if you have a 63-day gap after turning 65, Medicare will assess you 1% a month for all the years you don't have a drug plan. And now I've said this the last time I gave an example of one of my clients that's in her 80s, naturopathic. Now all of a sudden she needs lots of medicines, never had a drug plan, never needed one. Now she's going to be paying 150% increase in her premium for her drug plan. Now, the same thing is with Part B. This morning, I have someone returning from the Philippines, a friend of mine, and he has no Part B. He's been in the Philippines. He doesn't want to pay his $176 a month for a Part B premium because he thinks it doesn't work there. He's wrong, and I'm going to get him straightened out. But when he activates his Part B, he won't have any creditable coverage prior. And so they're going to assess him 10% a year of the premium for his Part B. Now, all three of us, are you on Medicare, Dennis?
Nope, mid-June.
In June. He's a young buck. He's a young buck. Last year, Judy and I and everyone that's listening to this paid $164 a month. Usually it's taken out of our Social Security, and that's for the premium for Part B. This year, it's gone up to $175 a month. And the deductible for Part B, if you're on a supplement, went up from 220 something up to 240. So it went up $14. It went up, the two of them together, about the amount of our increase on our Social Security raise, and that's pretty consistent. So I don't know. Did I answer the question? Okay.
So I'm a little confused though, Kevin. So if Judy's plan was with one specific provider,
yes,
and they were in negotiation, was she out of medical coverage at that time?
No.
Okay.
She was, if she had insisted on going to her providers at a place that was not a designated provider, not in network because of negotiations, she would have had to pay about a 30% increase on her copays. So if she had a Medicare that maybe her copay was $365, she might have had to pay an extra $100 or $110 because it would have been out of network. Now, in this situation, it was resolved shortly into the new year. It would have backdated to January 1st and it would have been covered in network.
Okay.
But yeah,
I had an appointment and I canceled it. And you told me that had it, even if it had taken longer or something, that you could have gone to battle for coverage, right?
That's actually a great lead into something I want to share. There is a neutral third party that if you need Medicare advice, you can go to. The organization is called Sheba. It's a government-run organization. These people will give you non-biased advice on plans. They can't answer the question that Judy is asking right now. They won't go to bat for you. But that's one place you can go, and I'll share the phone number with you for Sheba. It's 1-800-562-6900. And that's the neutral party. They make mistakes, and I've seen some of their printouts for folks that have come to my meetings, and I'll say, well, that's not 100% accurate, and here's why. But they are a good resource, and I encourage you to reach out to them if you don't know an agent. Now, the other option is you can contact me or my wife. My phone number is 360-355-6555. And besides giving you advice, we can also do things to help support you and fight issues that come up.
And what is the cost for your service?
Nothing. It's not to the beneficiary, the Medicare beneficiary. Medicare companies pay us to help support them and support their programs and help them with problems. The reason they do that is Medicare gives every company a grade. Every single policy that is issued has a star rating from 0 to 5, and Medicare will call every client. How did it work for you? How does the coverage? How are the doctors? So if you have an agent that's fighting for you, then you're getting resolution to issues and problems that come up, and so their star ratings will increase.
I know when we first started Medicare, and this is before you and I had met. I'm really sharing my age now, but my husband you can go online and you can compare all the different programs.
Yes.
It's so confusing. I was like, why are you doing this? We need to find someone who does this for a living and knows what it's all about, and it doesn't cost you anything. But we had someone else, but when I came to Kevin, we ended up with an even better policies. So it's really important that you have someone who knows what they're doing and who's willing to fight for you if there are things that come up that may not be correct.
Then that's my question. Why is Medicare so complicated?
Because it was designed and it functions through Congress and the Senate.
Okay.
So why is anything the federal government? There's a Part B and there's a Plan B. There's a Part C and there's a Plan C. What in the world? Plan C is a supplement. Part C means if you have an Advantage plan. It doesn't make sense. The fact that Part D is drugs is an accident. It just doesn't make sense. And it's constantly changing, like you've seen in this podcast.
I have a question for you. Are you familiar with GoodRx?
Yeah.
Put into the donut. We have used it, and I don't even know how it works, but it works to give really good discounts on drugs. I'm wondering, have you looked at that for your mom's, Dennis?
Yeah, we used it just recently, and it was amazing because one grocery store who has a pharmacy, the medication was $45. Another place it was $30. Another was $28. Through her health plan, it was $27. But we went to another place and we got it with a discount. We got it at $11.
So that's a huge saving. And so I don't really even understand how that works. Do you know?
Jen and I, my wife, we give all our clients a GoodRx card. It's a discount program that's free. Different than discount programs that'll cost you $4 or $5 a month. Never sign up for that. Every year I'll have a couple clients that got sucked into signing up for a $4 discount plan because it's so cheap, $4 a month, and I can use it with my other plan. No, Medicare will cancel your other drug plan if you're paying for a discount one.
I did not
Now, if your drug plan is embedded in your Advantage plan, when they cancel your drug plan, they just canceled your medical insurance. and you can't get new insurance till the following year. And every year I have one or two that fall into that.
Wow.
GoodRx is the exception. It has no charge. There is no fee for it. And it works great for tier threes. Most tiers 1 and 2 to somewhat, those are preferred generics and non-preferred generics, but plan C are name brand drugs. Name brand drugs will work about 75% of the time on GoodRx, and it's free. You can download the app in your app store, type in the medication, and just like Dennis was saying, it'll say Safeway price, Fred Meyer price, Target price, etc. And you can go there and show them your phone. Or what I tell all my clients, when you go in with a prescription, take your medical card and your GoodRx and hand it to them and tell them you want the cheapest. Because if it ends up being the GoodRx is cheaper to you, the other side of that, it doesn't count towards your donor hole. You don't fall in the donor hole if you're paying cash. So it's a good plan. It's free too.
I think a lot of people don't realize with Medicare is that many of the plans also offer gym memberships. Silver Sneakers.
Silver Sneakers is one of the networks. Yep.
Mhm. And my husband and my son, because my son is disabled and he has Medicare, Medicaid, they go to 24-hour fitness. And actually, it pays 24-hour fitness more money because they use it than they probably would make if they charged them.
The big expensive one is YMCA. That's usually included on all those Advantage Plan networks. That's $45 a month for seniors, and that's free. Now, this year, one company also offered Silver Sneaker program. It's not called, they don't call it that, but everyone knows it as that, on their supplement plans.
Wow.
So it's an added value service, and most of the time supplements don't cover that, but there's one company that will. Yeah.
So Silver Sneakers is a way of getting into a
gym for free.
gym. Okay.
In Longview, there are 4 or 5 gyms. Every one of them is in network for free. So I have ladies that go to Zumba over there, and they go to they'll go to all swimming on Wednesdays and Pilates on Thursdays, and there's all kinds of networks available to them, and it's all free. Now, one company, and I'll name them. On these kind of things, I try to stay unbiased, but United Healthcare will also give you awards for going to the gym. So I have a smartwatch thing that keeps track of my steps. Every time I do 7,500 steps 3 times a week, I get $10 a month.
Wow.
You go in for your flu shot or your pneumonia shot, you get $5. You go and do anything preventative.
So is that credited against what you're paying?
No, it goes into your account. You have to sign up. It's called Renew Active. It's free with United. You sign up, and then whenever you've got enough money in there. I have one lady that gets $250 a year in gift cards for herself and her husband.
I was not aware of that. I will go home and sign up for that now.
It's good. But get an agent. I recommend that you get an agent. It help you with step therapies, formulary exceptions, pre-authorizations, things that Shiva won't help you with. If you have to call the 800 number, and all of us love talking to India or the Philippines on those 800 numbers. Get an agent. You get the agent, most agents. In this case, you'll get my cell number, and I'll always answer. But sometimes I say, I'm fishing. If I hang up on you, I'll call you right back when I land this fish.
Somebody's turning, like me. If I didn't know somebody like you, and I'm going to be going to Medicare, or I'm thinking, God, maybe I need to change plans. What do I do besides going to the 1-800 number that has the former football player spouting information about Medicare?
Or Captain James T. Kirk, right?
Yeah.
Or Dynamite guy, right? First off, make sure that you get your Part B. Part A seems to always come rolling in. Part B, technically, you're supposed to opt out. It's supposed to come automatic, but it often won't. So if your birthday's in June, you told me?
Yes.
Right? So June is your birthday month. So we have May, April, and March. So March 1st is the earliest that you can contact Social Security to make sure that they have you in the system. 95% of the people, if they haven't moved in the last 5 years, Medicare will know it. Social Security will know it to send you and get you signed up for A and B. And that's what you want. They won't talk to you before 90 days prior.
Okay.
Now, your Medicare will start June 1st. Regardless of when your birthday is, unless your birthday is June 1st, then Medicare will start May 1st. So no matter what your birthday is, it'll start June 1st. But get your Part B, go to myssa.gov. Sign up for it there is easier. You can do it with calling 1-800-Medicare, but that's a long, drawn out process. Make sure you have A and B. Now, Part A is free because you've worked 10 years. I had a widower that didn't work 10. She only worked 5 because she's from Canada. So for her free Part A, she had to pay over $400 a month because she didn't have the 10 years yet. Part A is free. Part B is that $175 a month, $174.70, whatever. And make sure you pay that. Then we'll select your plan, and it's not one shoe fits all. It's not what your neighbor thinks is best. And I run into this at senior centers all the time. I ran into it with my own great uncle who's 94 this year. And I finally got him off his Advantage plan because all his friends were on it. And I got him on a supplement where he needs to be.
Real estate agents are,
Yes.
doesn't have a plan. I'm being covered by my wife who works within a school system. Do I go ahead and go through with this getting the Medicare?
Yes.
Absolutely. They're going to require that you get your Part A activated. You can opt out of Part B. You'll be part of PEB, Public Employees Benefit Bureau, or whatever it is for school teachers, for state employees. And PEB actually has great plans. 2 of the plans this year that they're offering are United. The uniform plan will cost you $800 a month, but the other United plan's not bad either. But I counsel all public employees, be careful. Make sure, because if you can afford the $800 a month, it's awesome coverage. Now we can get you close for about $39 a month instead of $800. But once you leave PEB, you can't go back.
Yeah.
Oh.
So I warn you, and then we have to do a verbal attestation that you're aware that you are giving up this public employee benefit and that you won't be able to get it back. So it's a serious consideration.
How about dental and vision coverage? What does Medicare cover in those areas?
Medicare covers absolutely nothing in those areas, except original Medicare, talking about Part A and Part B, your red, white, and blue card, except for things like glaucoma, disease of the eyes, cataracts, but they don't pay for glasses. They don't pay for regular eye exams that are not disease related. I just did an eye exam. I paid $49 for the part that everyone, the glasses and the prescription, because they were checking all my floaters, and the Medicare covered that part, but not the glasses. Dental is not covered. Now, if you get an Advantage plan, many of them have that built in and incorporated into the plan.
Okay.
Yours has fantastic. It's over $1,500 for dental, $300 for just the frames. The lenses are free on yours, but every plan's different. And some people don't care about that. So maybe a different plan would be better for you.
That's why an advisor is so important, somebody who knows what they're doing. Is there a clearinghouse for ratings for Medicare advisors?
But no, there is no clearinghouse. But you can look up any agent. You can look up Kevin Anderson on the state insurance website, and it'll tell you who I'm appointed with, how long I've been appointed with them, how long I've had insurance license, and if there's been complaints. And there hasn't been any. My E&O insurance is the lowest that it can be. I've got $3 million in errors and omissions insurance. So if I make a mistake, if I had made a mistake on your network, I would have been her insurance company when she had needed to have a bunch of work done. If I had made a mistake, my errors and omissions insurance would have paid up to $3 million for her care until I could fix it the following year. You should ask if they have errors and omissions. If they're appointed with sub companies, they don't require it. All the premier companies, and you brought up United Healthcare, they have 34% of the marketplace. The next 10 companies below them don't make up 30% combined. They're the largest, and they require errors and omissions insurance.
This is just mind-boggling, and I wouldn't suggest anybody try and do this on their own or go by the TV ad. That they just really need to find somebody they trust.
You can reach me at medicarekev@gmail.com, Medicare Kev, or you can call me at 360-355-6555, or I assume they could just reply to you if they're watching this podcast
Mhm.
and you can get them my contact information.
I think we will be posting it in the podcast too, right? Yes.
Yep.
And you have to remember, ethical agents never call you. We're not allowed to call you.
Okay.
Now, I can talk to this woman because she's my client. I can't call you, Dennis, unless I have permission in writing. You have to call me, and my permission is only good for 90 days. So when you get a phone call, someone talking to you about Medicare, it's illegal for them to do that. It's a scam. If it's not a scam, they could be legitimate agents. You can get licensed in 49 states. New York's the only one you can't get insurance license for.
Now, you're licensed in Washington and Oregon only?
Yes.
Yeah.
There are agents who are licensed in 49 states.
Oh, yeah, they're the ones with the TV ads. And so
Oh,
they put up a benefit. You go, I want that benefit. Well, you have to live in Timbuktu County of Tennessee because it is on a plan there. It's not in the plan in your neighborhood. So they can be legitimate, but if they're calling you and you have not signed a signature giving them permission to call, you can record it or get their name, and they're reluctant to give you full names, get their agent number, they're reluctant to give you that. And then when you hang up, call 1-800-Medicare. And because they always say, we're calling you on a recorded line. And every year I do this 3 or 4 times. I call Medicare and I'd like you to contact that company. And then they close them down. You get too many complaints, the insurance commissioner will kick you out of our state.
I learned the hard way that what county you're in really makes a difference. You have to be enrolled into a plan that covers your county. Is that true for
Yes.
all states?
If it's an Advantage plan, it doesn't matter for supplements. Advantage plan, you have to live in your county 6 months out of the year. And then if you get a PPO, you've got national coverage. Your plan will go with you to Hawaii or wherever you're going. Your plan will go with you when you enter through the ER room. Your plan will be there. You go to Mexico or Philippines, it'll be there for you. It goes by where you live or the state you pay taxes in the case of a supplement.
Okay.
But you can use it anywhere. If it's an HMO, it's going to be within the boundary of Washington.
Fantastic. Judy, you have any more comments or questions?
No, I think you've made me feel good moving forward with my Medicare plan this year. So thank you so much for coming back and helping us out again.
Any of you viewers don't like your Advantage plan, we can fix it by March 31st. It'll start April 1st. We can get you on a different plan if you need to be.
Great point. All right. That's it for today's episode of Getting Your
Bye-bye.
Edge, How to Right Size Your Home and Life podcast. I hope you found it valuable, and we'll see you next time. That's it, folks. Thanks for listening. And stay tuned for future episodes wherever you get your podcasts. Thanks. Goodbye.